Question 1. What is the primary method for sterilizing heat-tolerant dental instruments that penetrate soft tissue or bone? A. High-level disinfection. B. Intermediate-level disinfection. C. Autoclaving. D. Chemical germicides. Answer: C. Autoclaving. This question tests your foundational knowledge of infection control, specifically the most effective method for sterilizing critical instruments. The keywords heat-tolerant and penetrate soft tissue or bone define critical instruments, which must be fully sterilized. Autoclaving uses steam under pressure to destroy all microorganisms, including bacterial spores, making it the gold standard for sterilizing heat-stable instruments like surgical forceps or burrs. Disinfection methods, even high-level, do not reliably kill all spores and are therefore insufficient for critical items. For example, after a tooth extraction, all surgical instruments used would be processed and then sterilized in an autoclave. Always remember that for instruments that enter sterile body areas, sterilization is the only acceptable method. Question 2. Which of the following is the correct universal numbering system for the maxillary right second premolar, tooth number 5? A. Number 3. B. Number 5. C. Number 12. D. Number 14. Answer: B. Number 5. This question evaluates your essential knowledge of the universal numbering system, a fundamental concept for identifying teeth. The keyword maxillary right second premolar specifies a particular tooth location. In the universal numbering system, permanent teeth are numbered 1 through 32, starting with the maxillary right third molar, #1, and moving clockwise around the arches to the mandibular right third molar, #32. The maxillary right second premolar is consistently assigned the number 5. Understanding this system is crucial for accurate charting and communication in the dental office. For example, if a dentist says, "Let's prepare number 5 for a crown," you immediately know exactly which tooth they mean. Memorize the numbering sequence for quick and accurate tooth identification. Question 3. What is the primary purpose of applying a lead apron with a thyroid collar to a patient before taking dental radiographs? A. To prevent motion during the X-ray exposure. B. To minimize radiation exposure to sensitive tissues. C. To absorb excess heat from the X-ray tube. D. To help the patient relax during the procedure. Answer: B. To minimize radiation exposure to sensitive tissues. This question tests your understanding of radiation safety protocols in dental radiography, a critical area for patient protection. The keywords lead apron with a thyroid collar highlight protective shielding. The primary purpose of this protective gear is to block unnecessary X-ray radiation from reaching radiosensitive organs, such as the thyroid gland and reproductive organs, adhering to the alara, as low as reasonably achievable. Principle: it does not prevent motion, absorb heat, or directly relax the patient. For example, before taking a full-mouth series of X-rays, you would always make sure the patient is wearing the lead apron and thyroid collar correctly. Remember, protecting the patient from radiation is paramount, and the lead apron is your first line of defense. Question 4. When assisting with the placement of a composite resin restoration, what is the role of the etchant? A. To clean the tooth surface thoroughly. B. To dry the tooth completely before bonding. C. To create microscopic porosities for mechanical retention. D. To desensitize the tooth structure. Answer: C. To create microscopic porosities for mechanical retention. This question assesses your knowledge of dental materials and the specific steps involved in composite resin bonding. The keyword etchant refers to an acidic material, usually phosphoric acid, applied to the enamel and sometimes dentin. Its crucial role is to roughen the tooth surface microscopically by demineralizing it, creating tiny pores or etch patterns. These porosities allow the subsequent bonding agent to flow into them and create a strong mechanical interlock with the tooth structure, which is essential for the composite to adhere properly. While it helps clean slightly, its main function is not just cleaning or drying, nor is it a desensitizer. For example, after applying the etchant, the surface of the tooth will appear frosty white, indicating it's ready for the bonding agent. Always remember that etchant is the key to creating a strong, lasting bond for composite restorations. Question 5. If a patient experiences syncope, fainting, in the dental chair, what is the immediate first action an RDA should take? A. Administer oxygen. B. Place the patient in a supine position with feet slightly elevated. C. Call for emergency medical services, EMS. D. Offer the patient a sugary drink. Answer: B. Place the patient in a supine position with feet slightly elevated. This question tests your response to a common medical emergency in the dental office. The keyword syncope, fainting, indicates a temporary loss of consciousness due to reduced blood flow to the brain. The immediate and most effective action is to quickly place the patient in a supine, flat on their back, position with their feet slightly elevated. This position helps to increase blood flow back to the brain, which usually resolves the episode quickly. While oxygen may be administered if needed and EMS called for prolonged unresponsiveness, positioning is the crucial first step. For instance, if a patient faints, carefully and quickly recline the chair fully and lift their feet. Remember, the goal is to get blood back to the brain as fast as possible. Question 6. Which instrument is essential for detecting carious lesions, cavities, and calculus on tooth surfaces? A. Periodontal probe. B. Cotton pliers. C. Explorer. D. Spoon excavator. Answer: C. Explorer. This question evaluates your ability to identify the function of a fundamental diagnostic instrument. The keywords detecting carious lesions, cavities, and calculus directly describe the primary role of the explorer. The explorer has a thin, sharp, pointed tip that allows the dentist or hygienist to feel for changes in tooth texture, such as soft spots indicative of decay, or rough areas caused by calculus, hardened plaque. A periodontal probe measures gum pockets, cotton pliers pick up small items, and a spoon excavator removes soft decay. For example, during a routine checkup, the dentist will use an explorer to meticulously check the grooves and surfaces of each tooth. Always remember that the explorer is your detective tool for finding potential problems on tooth surfaces. Question 7. What is the main function of the high-volume evacuator, HVE, during dental procedures? A. To deliver a stream of air to dry the operative field. B. To remove large amounts of water, saliva, and debris. C. To provide light directly onto the tooth being treated. D. To rinse the patient's mouth with water. Answer: B. To remove large amounts of water, saliva, and debris. This question assesses your understanding of basic chairside assisting equipment and its crucial role in maintaining a clear operating field. The high volume in HVE is the key clue, indicating its powerful suction capabilities. The HVE is specifically designed to quickly and efficiently remove the substantial amounts of water, saliva, blood, and tooth fragments generated during procedures, especially when a high-speed handpiece is used. It is distinct from the air/water syringe, which delivers air or water, and it does not provide light. For example, while the dentist is preparing a tooth with the drill, the RDA continuously positions the HVE tip to keep the area visible and dry. Remember, the HVE is indispensable for keeping the working area clear and comfortable for the patient. Question 8. What is the fundamental principle behind informed consent in dentistry? A. The patient must agree to treatment only if insurance covers it. B. The patient is told about the proposed treatment, risks, benefits, and alternatives, and freely agrees. C. The dental team decides the best treatment and informs the patient of the decision. D. The patient receives a written quote for the cost of treatment before proceeding. Answer: B. The patient is told about the proposed treatment, risks, benefits, and alternatives, and freely agrees. This question tests your knowledge of a core ethical and legal principle in patient care. The concept is understanding what informed consent truly means. Informed consent requires that a patient receive a clear explanation of their diagnosis, the recommended treatment, potential risks, expected benefits, and any reasonable alternative treatments, and then voluntarily agree to the proposed plan. This ensures the patient has all necessary information to make an autonomous decision about their health. It's more than just a financial agreement or a simple yes, it's about mutual understanding and respect for patient autonomy. For example, before a patient undergoes a root canal, the dentist explains the procedure, its success rate, and possible complications, and the patient signs a form indicating they understand and agree. Always remember, informed consent means the patient makes the decision after being fully educated about their options. Question 9. Which type of dental cement is commonly used for temporary restorations or as a sedative base due to its palliative, soothing, effect on the pulp? A. Zinc phosphate. B. Glass ionomer. C. Zinc oxide eugenol, ZOE. D. Polycarboxylate. Answer: C. Zinc oxide eugenol, ZOE. This question assesses your knowledge of various dental cements and their specific clinical applications. The keywords temporary restorations and sedative base with palliative effect are strong indicators. Zinc oxide eugenol, ZOE, cement is well known for its soothing effect on inflamed dental pulp due to the eugenol component, making it an excellent choice for temporary fillings, temporary cementation of crowns, or as a base under restorations to reduce sensitivity. Other cements like zinc phosphate are irritating, while glass ionomer and polycarboxylate have different primary uses. For example, if a patient has a deep cavity, the dentist might place a ZOE temporary filling to allow the tooth to calm down before placing a permanent restoration. A good way to remember it is that eugenol sounds a bit like eases pain, which is its key feature for the pulp. Question 10. The chewing surface of posterior teeth is referred to as the A. Lingual surface. B. Facial surface. C. Proximal surface. D. Occlusal surface. Answer: D. Occlusal surface. This question tests your fundamental understanding of dental anatomy, specifically the names of tooth surfaces. The keyword chewing surface of posterior teeth directly describes the occlusal surface. This is the flattened or cusped surface of molars and premolars that comes into contact with teeth in the opposing arch during chewing. The lingual surface faces the tongue, the facial, buccal/labial, surface faces the cheek or lips, and proximal surfaces are the sides that touch adjacent teeth. For example, when applying a sealant, the dental assistant targets the grooves and pits on the occlusal surface of a molar. Remembering these terms is crucial for accurate communication about tooth locations and conditions. Question 11. What is the minimum recommended time for vigorous hand washing with soap and water in a dental setting? A. 5 seconds. B. 10 seconds. C. 20 seconds. D. 30 seconds. Answer C. 20 seconds. This question assesses your critical knowledge of infection control, specifically the standard guidelines for effective hand hygiene. The keyword minimum recommended time for hand washing emphasizes the importance of adequate duration. According to public health guidelines, including those for healthcare settings, scrubbing hands vigorously with soap and water for at least 20 seconds is necessary to physically remove transient microorganisms and reduce the risk of cross-contamination. Shorter durations are generally insufficient. For example, before putting on gloves for patient care, you would ensure you wash your hands thoroughly for the full 20 seconds. Always remember that 20 seconds of thorough hand washing is a simple yet powerful barrier against infection. Question 12. The ALARA principle in dental radiography stands for A. Always limit all radiation always. B. As low as reasonably achievable. C. Allow less and radiograph accordingly. D. Avoiding limited and risky applications. Answer B. As low as reasonably achievable. This question tests your essential knowledge of radiation safety principles in dental radiography. The acronym ALARA is a fundamental concept for minimizing patient and operator exposure to radiation. ALARA stands for as low as reasonably achievable, meaning that all reasonable efforts should be made to reduce radiation exposure while still obtaining diagnostic quality images. This principle guides decisions like using lead aprons, thyroid collars, proper film selection, and optimal exposure settings. It's not about always limiting all radiation, but rather being mindful and practical in minimizing it. For example, using digital X-rays instead of traditional film helps adhere to ALARA because digital requires less radiation. Always remember ALARA as your guiding principle for safe radiography. Question 13. When mixing alginate for an impression, how should the powder be added to the water? A. Pour all the powder into the water at once. B. Gradually sprinkle the powder into the water. C. Add water to the powder in small increments. D. Mix the water and powder separately before combining. Answer B. Gradually sprinkle the powder into the water. This question assesses your practical knowledge of dental materials, specifically the proper technique for mixing alginate impression material. The concept is achieving a smooth, homogeneous mix. The correct method is to gradually sprinkle the alginate powder into the measured water. This technique allows the powder to become fully saturated and reduces the formation of air bubbles or dry spots, which can lead to a grainy mix and inaccurate impressions. Pouring all at once or adding water to powder can result in lumps. For example, while stirring the water in the mixing bowl, slowly sift in the powder until it's all incorporated before vigorously spatulating. Remember, a smooth mix starts with how you add the powder to the water. Question 14. When treating a very young child who is anxious, which of the following is the most effective communication technique for the RDA? A. Speaking in a loud, firm voice to gain cooperation. B. Using tell-show-do approach with simple language. C. Threatening to stop treatment if they don't cooperate. D. Ignoring their fear and proceeding quickly. Answer B. Using tell-show-do approach with simple language. This question evaluates your patient management skills, particularly with anxious pediatric patients. The keywords very young child and anxious highlight the need for a gentle and reassuring approach. The tell-show-do technique is highly effective. First, tell the child in simple, non-threatening words what will happen, then, show them the instruments and how they work. Finally, perform the procedure gently. This approach builds trust and reduces fear by making the unknown familiar. Speaking loudly, threatening, or ignoring fear will only increase anxiety. For example, before using the suction straw, tell the child, "I'm going to put a little straw in your mouth to catch the water," then show them the HVE tip, and then gently place it. Remember, building trust with children through simple explanations and demonstrations is key to a positive dental experience. Question 15. Which of the following instruments is always part of a basic setup for a dental examination? A. High-speed handpiece. B. Surgical scalpel. C. Mouth mirror, explorer, cotton pliers. D. Amalgam carrier. Answer: C. Mouth mirror, explorer, cotton pliers. This question tests your fundamental knowledge of chairside assisting, specifically identifying the standard instruments for any basic examination. The term basic setup refers to the core instruments needed for every routine checkup. This universally includes a mouth mirror for indirect vision, light reflection, retraction, an explorer for detecting decay and calculus, and cotton pliers for picking up and transferring small items like cotton rolls. Other instruments like a high-speed handpiece, scalpel, or amalgam carrier are procedure-specific, not part of a basic examination setup. For example, when you set up for a new patient's exam, these three instruments are always on the tray. Always remember that the mouth mirror, explorer, and cotton pliers are the essential trio for any initial examination. Question 16. What is the primary cause of dental caries, cavities? A. Excessive brushing and flossing. B. Bacterial acids dissolving tooth enamel. C. Too much fluoride exposure. D. Trauma or injury to the tooth. Answer: B. Bacterial acids dissolving tooth enamel. This question assesses your understanding of basic oral pathology, specifically the etiology, cause, of dental caries. The keyword primary cause of dental caries points to the fundamental process. Dental caries, or cavities, are caused when specific bacteria in the mouth metabolize sugars from food and drinks, producing acids. These acids then dissolve the protective enamel layer of the tooth, leading to demineralization and eventually a cavity. While other factors contribute, the acid attack from bacteria is the direct cause. Excessive brushing can cause abrasion but not cavities, too much fluoride causes fluorosis, and trauma causes fractures, not caries. For example, if someone frequently snacks on sugary foods, the bacteria in their mouth have more fuel to produce acids that attack their teeth. Always remember that sugar plus bacteria equals acid, and acid equals cavities. Question 17. When pouring a dental impression with gypsum, what is the most important step to prevent air bubbles in the stone model? A. Mixing the gypsum very quickly. B. Pouring the gypsum into the impression in one large glob. C. Using a vibrator while incrementally adding gypsum to the impression. D. Heating the water before mixing with gypsum. Answer: C. Using a vibrator while incrementally adding gypsum to the impression. This question tests your practical knowledge of laboratory procedures, specifically how to achieve a high-quality gypsum model from an impression. The keywords prevent air bubbles and stone model highlight a common challenge in pouring models. The most effective way to prevent air bubbles is to use a laboratory vibrator. By placing the impression on the vibrator and incrementally adding small amounts of mixed gypsum to the deepest part of the impression, the vibrations help the gypsum flow into all crevices and push out any trapped air. Mixing quickly or pouring a large glob will increase bubbles, and heating water is not recommended. For example, when pouring a maxillary alginate impression, hold the tray on the vibrator and slowly allow the gypsum to flow from one side to the other. Always remember that a vibrator and incremental pouring are your best friends for bubble-free models. Question 18. Which category of drugs is commonly prescribed to manage mild to moderate dental pain? A. Antibiotics. B. Antihistamines. C. Analgesics. D. Antivirals. Answer: C. Analgesics. This question assesses your basic understanding of pharmacology, specifically the classification of drugs by their therapeutic effect. The keyword manage mild to moderate dental pain is the direct clue. Analgesics are a class of medications specifically designed to relieve pain. This category includes over-the-counter options like ibuprofen and acetaminophen, as well as stronger prescription pain relievers. Antibiotics fight bacterial infections, antihistamines treat allergic reactions, and antivirals combat viral infections. For example, after a tooth extraction, the dentist might recommend an over-the-counter analgesic like ibuprofen to help manage any discomfort. Always remember that analgesic is the medical term for a pain reliever. Question 19. What is the ideal ergonomic position for the dental assistant when working chairside? A. Standing upright with arms extended to reach instruments. B. Seated with a straight back, feet flat, and thighs parallel to the floor. C. Leaning over the patient to get a closer view. D. Seated on the edge of the stool, close to the patient's head. Answer: B. Seated with a straight back, feet flat, and thighs parallel to the floor. This question tests your knowledge of ergonomics, a critical aspect of dental assisting for preventing musculoskeletal disorders. The concept is maintaining proper posture and positioning to ensure comfort and longevity in your career. The ideal ergonomic position for the dental assistant is seated comfortably with a straight back, feet flat on the floor, or on the stool ring if feet don't reach, and thighs parallel to the floor. This neutral position minimizes strain on the back, neck, and shoulders. Standing with extended arms, leaning over, or sitting on the edge of the stool all lead to poor posture and potential injury. For example, make sure your stool is adjusted so you can sit tall and comfortably with good support while assisting. Always prioritize your posture and adjust your equipment to maintain a healthy ergonomic position. Question 20. To prevent air bubbles from being incorporated into an impression, what is the proper technique when loading impression material into a tray? A. Scoop a large amount into the center of the tray. B. Place material along one side of the tray, then push it across to the other side. C. Vigorously shake the tray after loading to settle the material. D. Load the material from the posterior of the tray toward the anterior. Answer: B. Place material along one side of the tray, then push it across to the other side. This question assesses your practical skills in impression taking, specifically techniques to ensure a bubble-free impression. The keyword prevent air bubbles highlights a crucial step for impression quality. When loading impression material, it is best to place a bulk of the material along one side of the tray and then use the spatula to push it across to the other side, filling the tray progressively. This technique helps to minimize air entrapment compared to scooping into the center or loading from posterior to anterior. Shaking the tray can introduce more bubbles. For example, when loading a tray with alginate, you'd place a strip along the buccal rim and then sweep it across. Always remember to load impression material in a way that minimizes trapped air for the best results. Question 21. What is the purpose of the curing light when placing a composite resin restoration? A. To remove any remaining decay from the tooth. B. To harden the resin material through polymerization. C. To bond the composite directly to the tooth enamel. D. To etch the tooth surface for better adhesion. Answer: B. To harden the resin material through polymerization. This question tests your understanding of dental materials and the process of placing composite restorations. The keyword curing light is the direct clue. The curing light emits a specific wavelength of blue light that activates photoinitiators within the composite resin. This activation causes the resin to undergo polymerization, a chemical reaction that converts the soft, pliable material into a hard, durable restoration. The light does not remove decay, directly bond the material, that's the bond agent's job, or etch the tooth, that's the etchant's job. For example, after placing and shaping the composite material in the cavity, the dentist or RDA uses the curing light to harden it. Always remember that the curing light is what makes the composite go from soft to strong and solid. Question 22. Which personal protective equipment, PPE, is most important to protect the dental assistant from airborne pathogens and aerosols during procedures? A. Safety glasses. B. Face shield. C. Utility gloves. D. High filtration mask, e.g., N95 or surgical mask. Answer: D. High filtration mask, e.g., N95 or surgical mask. This question assesses your critical knowledge of infection control and the appropriate use of personal protective equipment. The keywords airborne pathogens and aerosols highlight the need for respiratory protection. A high filtration mask, such as an N95 respirator or a surgical mask, is essential for protecting the dental assistant's respiratory system from inhaling airborne contaminants generated during many dental procedures, e.g., drilling, ultrasonic scaling. While safety glasses and face shields protect the eyes and face from splashes, and utility gloves protect hands during instrument processing, only a mask provides direct respiratory protection from aerosols. For example, before assisting with an ultrasonic scaling, you would don your mask, eye protection, and gloves. Always remember that your mask is your primary defense against breathing in harmful airborne particles. Question 23. What is the dental specialty focused on the prevention, diagnosis, and treatment of malocclusion, improper bites, and facial irregularities? A. Endodontics. B. Periodontics. C. Oral surgery. D. Orthodontics. Answer: D. Orthodontics. This question evaluates your understanding of dental specialties and their scope of practice. The keywords malocclusion, improper bites, and facial irregularities are direct indicators for a specific field. Orthodontics is the specialty dedicated to correcting misaligned teeth and jaws, improving both oral function and facial aesthetics. Endodontics deals with the tooth's pulp, periodontics with gum disease, and oral surgery involves surgical procedures in the head and neck. For example, a patient with crooked teeth or an overbite would be referred to an orthodontist for treatment like braces or clear aligners. Knowing these specialties helps you understand patient referrals and treatment plans. Question 24. Which type of patient record is considered a legal document and provides a comprehensive history of all dental treatment received? A. Appointment book. B. Financial ledger. C. Clinical chart. D. Lab requisition form. Answer: C. Clinical chart. This question tests your knowledge of essential dental office documentation. The keywords legal document and comprehensive history of all dental treatment clearly describe the clinical chart, often referred to as the patient's dental recordee. This record contains the patient's medical and dental history, clinical findings, diagnosis, treatment plans, progress notes, and all treatments rendered, including dates, materials, and procedures. It serves as a vital legal record and a crucial communication tool for the entire dental team. An appointment book is for scheduling, a financial ledger tracks payments, and a lab requisition is for lab work orders. For example, every detail of a filling placement, from anesthetic to material used, must be accurately recorded in the clinical chart. Always remember that the clinical chart is the backbone of patient care and a key legal document. Question 25. Before the dentist injects local anesthetic, what critical step should the RDA ensure the dentist performs to prevent injecting into a blood vessel? A. Recapping the needle. B. Aspirating. C. Wiping the injection site with alcohol. D. Administering nitrous oxide. Answer B. Aspirating. This question assesses your understanding of local anesthesia administration and patient safety. The keyword prevent injecting into a blood vessel points to a vital safety measure. Aspirating means the dentist pulls back slightly on the plunger of the anesthetic syringe before injecting the solution. This action creates negative pressure to check if blood enters the cartridge, indicating the needle tip is inside a blood vessel. If blood is seen, the needle is repositioned, reducing the risk of systemic complications. Recapping is for safety after use, wiping with alcohol is for disinfection, and nitrous oxide is for sedation, not vessel detection. For example, you might observe the dentist perform this aspiration step every time before slowly delivering the anesthetic. Always remember that aspiration is a quick, critical check to ensure the anesthetic is deposited in the correct location, away from blood vessels.